these issues, depression and anxiety, are very treatable, but we got a big access problem in terms of getting, yes, okay, yeah, huge access problem. So we'll talk about that as well. All right, so what is depression? You know, I think when we talk about depression, most people have something in mind, right, about what that is. Usually somebody, you know, kind of cowering in a corner with a blanket over their head, you know, with a noose around their neck. That's kind of a common perception, but it can look very differently. The official terminology for depression comes from the DSM-5 technical review, which just came out recently, DSM-5 TR. And the main points about depression is that, you know, it is a disorder of mood, so sadness, emptiness. There's also a behavioral component. For children, you may see more irritability. People don't often think about that. It's also true for adults, but it's actually codified in the DSM that it can be irritability in terms of that mood component in children. So if you got that angry person in your clinic, poke around, you might find depression. It's something you want to keep in mind. Depression isn't just mood, it's also physical. There's a big somatic component to depression. And it's also a disorder characterized by cognition, those negative thoughts. I'm worthless, nobody cares. You people in the clinic don't care what happens to me, okay? That's the cognitive piece. The somatic piece is something I think we don't often understand. We're going to see this with anxiety as well, but there is a very strong somatic component to depression and anxiety. Nausea, diarrhea, vomiting, chest pains, headaches. Sound like your patients, right? How do you tease that out from kidney disease, right? So I spent a lot of time in my work working with patients and trying to understand their physical symptoms, very real physical symptoms that my medical colleagues have no explanation for, okay? And includes chronic illness populations like renal disease. So keep that in mind. Depression isn't just mood, it's cognition, it's also physical, okay? Now, the DSM has several different categories, for depressive disorders, same way with anxiety disorders. There they are. Our job is to really try to tease these things out. Again, as a consulting psychologist, my favorite is unspecified, okay? But this is what you're going to see. So in pediatrics, this is my opinion, this is my observations over the years, okay? Not so much what you see in the literature, but there's a few common depressive disorders that you're most likely to see. Major depressive disorder is what we typically think of as depression. It's the sad, depressed, irritable mood. It's sleep and appetite disturbance, problems with attention. Keep that in mind. Problems with attention, which affects memory. People forget their medications. They forget to pick them up, right? That kind of thing. Certainly suicidal ideation, that kind of thing. Now in pediatrics, suicide is the second leading cause of death of children. And that's for kids from 10 to 15, if I'm remembering that correctly, and then from 16 up to about 25, it's the third leading cause of death. Okay? Suicide. First leading cause of death in our youth are accidents. And then, depending on the age group, it's either second or third is homicide. Those are our top three killers of our kids. Cancer is a distant fourth, and I don't remember where renal disease falls in that. So behavioral issues. So suicide and identifying depression in our youth is incredibly important. For adults, again, major depressive disorder is kind of the standard. Persistent depressive disorder used to be called dysthymia. We're kind of getting away from those older terms. Persistent depressive disorder is basically graduate students, okay? Yes. Just that kind of low level, sadness that's chronic and ongoing kind of thing. So those are some of the common ones there. Anxiety, again, as codified by the DSM, is excessive fear or excessive anxiety. I'm feeling a little bit of anxiety right now. Do I have a disorder? No. Maybe. Maybe not. Cindy says no. Okay, no, I do not have an anxiety disorder. So, again, it's like all these things. It's not just that people experience symptoms. We're all prone to depressive symptoms. We're all prone to feeling anxious from time to time. That's just part of being a human being. But it's when these things get to be excessive and they really start to interfere with life, your ability to function and go on about your business. So here's some of the more common anxiety disorders. Generalized anxiety disorder, you're just anxious everywhere. It's kind of globally, multiple settings. Social anxiety disorder. If I had an anxiety disorder, this would be it. Standing up here in front of a bunch of people that I don't know. So difficulty functioning in public. Panic disorder. Those panic symptoms, people coming in with heart palpitations, racing heart, again, stomach issues, tingling, odd sensations in your hand and feet, lower extremity weakness, weakness in general, pain. Again, does it sound like people you know? Okay. Again, in my world, as a consulting psychologist, we see a lot of kids who are coming in with suspected seizures, and we do our workup, it's like they're having panic attacks. Okay? So very common. Specific phobias, needle phobias. Again, taking a developmental perspective, this is a good one to talk about developmental perspective. A 3-year-old who's afraid of a needle, is that a pathology? No. 30-year-old? Yeah, maybe. Sure. Absolutely. And selective mutism. That's a really interesting one. These kids, and this is typically in pediatrics, they won't talk. You ever meet a kid in a clinic who just won't talk to you? Okay? They won't talk at school. They won't talk, they do talk. They'll talk to their family. They'll talk to close friends, that kind of thing. But it's a very selective, it's an anxiety-based issue. And it can have some really severe impacts on a child's ability to engage with their health care. Certainly has a big impact on their ability to engage at school. So a lot of academic problems come with that. So I touched on this a little bit already in terms of anxiety disorders. What I tend to see as some of the common things is that the generalized anxiety, which we talked about, it happens in, a person has some debilitating anxiety in multiple places. Separation anxiety, again, is a particularly pediatric condition. We're going to talk about some other things like reactive attachment. If you think about, for those of you who work in pediatrics, if you have a child who has a congenital condition, right, and they have a lot of early hospitalizations, because of the separation, that lack of ability to fully engage in all the physical nurturing and all that, can really impact their later development in terms of being able to separate, make age-appropriate separations and that kind of thing. So sometimes the nature of our renal disease, the nature of taking care of renal disease, can have some negative consequences in terms of promoting some things like separation anxiety and some reactive attachment kinds of issues. And these are with parents that are good parents, trying their best, doing all those things. So those are some things we just need to be mindful of.